Hey, all you cool cats and kittens. Here we are. The dynamic duo is back. We've heard a lot about Zoom, so we thought we would give it a try. In all seriousness, we're both home, working from home, answering all of your calls. The phones have been ringing off the hook, and we're happy to field your calls, questions, and answers. So we're here today to talk about antibody testing. We're very excited.
We are very excited. It's, again, our phones are ringing off the hook, and we are really thankful for all the patience that people are displaying, waiting for those phone calls and waiting to have us get back in touch with you. And we're excited.
Yeah. So let's talk about antibody testing. What is antibody testing?
The test that we're doing in the office is a finger stick test. You get 1 drop of blood, and from that blood you can detect whether you have any IgG or IgM antibodies. Antibodies are proteins that your body makes in response to an infection. So in this case with a coronavirus, if you've been exposed to it, we would expect that over a period of time, your body should start making antibodies against that infection.
So some people are going to test positive for IgM, but not IgG. Why are there 2 types of antibodies, and what does that mean?
When your body gets exposed to an infection, there are initial antibodies that are formed usually within the first few days. And those antibodies, that's IgM, those antibodies peak usually about 2 weeks afterwards. After that, your body makes long-term antibodies, IgG. IgG are the antibodies that we think will protect you, at least for a period of time, from getting the infection again.
Right, so the ideal test result would be that your IgM antibodies are negative because you are no longer infected, and your IgG antibodies are positive because you have beaten the infection and built up some sort of immunity towards the virus.
Right. And, because we're really early in the pandemic, we don't yet know how long immunity lasts. We don't know at what level that immunity develops, but we suspect that it's probably at least for a year, maybe 2, that you would have immunity against this infection. And then the other thing that this antibody test does is it opens up the door for donating your plasma for people that are really, really sick.
That sounds great. So who is the ideal candidate to get antibody testing? Why would I choose to have antibody testing versus a nasal swab?
Well, the nasal swab is still the test of choice, at least at this point, if you are sick. So if you're sick and you think you might have an active coronavirus infection right now, then we still are doing those nasal swabs through our drive-up testing. So we definitely want you to do that test. An antibody test, honestly, can be anyone. Anyone that thinks that they had an illness that may have been COVID in the last few months, anybody that had been exposed to a lot of people with COVID in the past, they might have developed antibodies. Or if you're curious and you don't know whether you were one of the asymptomatic people that actually got exposed to the virus and developed antibodies. So we actually want to see as many people and test as many people as possible, because then that's going to give us a lot better idea of what's going on in the community and a lot better idea of how many people actually have developed immunity.
So some people that could be tested would be asymptomatic people who are never sick. People who were sick or exposed, the ideal testing time would be someone who was sick or tested positive or maybe didn't have a test 3 to 4 weeks ago. It wouldn't be somebody who tested positive last week or just a couple weeks ago.
That's right. Yeah. We've had some people that have called in and they got over an illness a couple weeks ago, and we've told them to wait for another 2 weeks because there's a chance that if you do that antibody test too early, it's going to come back negative and your body may not have made those antibodies yet.
Great. So Any and all people welcome to take antibody testing. Some patients that tested positive with us for the swab are coming back in 3 to 4 weeks to do antibody testing to see if they've built up immunity. And then at that point, they can donate plasma. So what is that about? Some patients have asked me if we're doing donations for plasma or where they can go for that.
Yeah, so we're actually referring most of our patients to the American Red Cross. They have a convalescent plasma program. And if you go to their website, there's actually a form that you can complete online. It asks when you were tested for COVID, and if you're symptom-free, how long ago, and then that gets submitted, and then they usually go through a process there. They might need to do some blood draws, some screening tests, but the first step is to start at the American Red Cross and submit that form, and then from there, usually they'll get in touch with you.
Awesome. All great information for people to have.
We finally are getting more data. We have the ability to actually bring back some of our early patients that tested positive, as you had mentioned, for COVID. And what we're seeing on our testing is that those patients that tested positive about a month ago, we're seeing that they actually do have the antibodies now on our antibody test. So some people have asked about the accuracy of the test, and the test that we're using is actually a test that has been used in a research study in Stanford University, where they tested over 3,000 patients. And that test has actually been validated with a specificity and sensitivity, meaning the accuracy, a true positive versus a true negative. We feel pretty confident in the results of this test. And we're also seeing those results with people that we would expect to have antibodies already coming back positive.
Awesome, right, because with the nasal swab, there's up to a 20% chance that it's a false negative, that your negative test is not really negative. But with the antibody testing, it's pretty close to zero. So if there are no antibodies, it's pretty accurate that you just don't have any antibodies, whether you had the virus or not.
Right.
But more than likely, you didn't have the virus.
More than likely, yeah.
All right, well, that's it from us today. I wore this sweater in honor of Tiger King, just to show you how busy Dr. Beckman is. He has not watched Tiger King during the pandemic yet.
I've not watched Tiger King, although if you had given me heads up, I maybe could have scrounged up some cat-related apparel. But
his homework for the weekend. Take care, everybody.
Bye, guys.